years later, and we still don't know everything that's in Obamacare or how it will impact California. I'm Alexis Garcia with Cal Watchdog's Brian Calle. So, Brian, what exactly is in store for us with Obamacare?
Well, I mean, part of the problem is we don't exactly know, and I think more and more legislators are figuring that out as well. I mean, even Democrats who voted for Obamacare and Democrats who have been supportive of Obamacare in California and elsewhere understand now that it's very unclear what this law entails. And that's a scary thing if you're someone who wants more government involvement in healthcare or if you're someone who doesn't want more government involvement in healthcare. From a California perspective, however, I don't, putting implementation aside and the benefits or the negative impacts of Obamacare, what frightens me are the economic implications in particular. And what we oftentimes forget is that California is a hub of certain economic sectors, and one of those sectors is the medical device sector. And a big portion of Obamacare is funded by a medical device tax, and it's going to cause some economic upheaval in the state of California and elsewhere.
We've already seen business here struggle. What do you think that tax is going to do to these business owners?
I can tell you exactly what it's going to do. I mean, you have some companies in California, medical device kind of startups that made profit for the first time last year or the first time the year before, who will have their profit completely wiped out, literally completely wiped out. And they won't hire or they'll even lay off people. Then you'll have the bigger dogs, which you have a lot of them are in Orange County. You have some up in the Bay Area as well, and they're going to look at the global marketplace and they're going to say, do I stay in California and the United States and get taxed for a product that I'm trying to develop, or do I move and put our research and development facilities in Singapore? We don't have those types of taxes, or maybe in China, or maybe in South America, where the government will even give us land.
On a personal level, we're seeing about 7 million people that are going to enter the healthcare system just in California. What does that do to the already strained system of doctors and nurses in this state?
Yeah, I mean, the interesting thing is that, I don't think that we have the capacity in California in terms of the medical professionals needed. I think that there's already a shortage of nurses a lot of places and medical doctors, and you're also seeing a lot of doctors who had been in, various practices go into concierge service now to just completely get out of the industry as it was, because they don't know what to expect and they don't know what their pay rates are going to be. And so we're at that kind of point where we're actually feeling the impact of the law. And when you pass a law like Obamacare with such sweeping consequences, if you're the Obama administration or someone like Senator Feinstein or Senator Boxer who voted in favor of the Affordable Care Act, you want people to be feeling the positive benefits of it. But the problem is you're not seeing those stories. Those aren't the stories that are out there, and that's the real tragedy with Obamacare.
Yeah, and what you're seeing is just a constant revision of how much this is going to cost. We know that if businesses don't offer plans, they're going to get fined. California also wants to fine them more money than what the plan would cost. How do you think this is going to affect this brick and mortar business?
One of the scariest elements of Obamacare is the unintended consequences, right? A lot of people are saying, okay, well, there's all these rules in terms of me as an employer having to provide health care to my employees. And now people are saying, I'll put the employees on contract. They'll no longer be full-time employees. And so now the state of California is coming back and saying, okay, we got to stop that. So maybe we'll pass a law that disallows that somehow.
Let's tax them more.
Let's tax them more, exactly. So it's causing all of these unintended consequences and headaches, which is another testament to why this law needs kind of to be revisited in Washington, D.C. And the problem is that in California, I feel as though our insurance commissioner, the state insurance commissioner in particular, is hell-bent on not just Obamacare in its current form, but also a single-payer system and finding a way to make that work in California. And these new tax provisions or tax ideas might get closer to that end goal. The challenge, of course, being is, as we discussed a few minutes ago, the outcomes have been atrocious so far. So at what point do we start seeing these purported benefits of Obamacare? Because right now they don't exist.
Well, Brian, thank you so much.
Thanks.
For Cal Watchdog, I'm Alexis Garcia. Don't forget to follow us on Twitter and like us on Facebook.